Scenario 1. Follow-up appointment. Good morning, Mrs. Davis. It's good to see you again. How have you been feeling since we started you on the new blood pressure medication 2 weeks ago?
Good morning, Dr. Lee. Overall, I've been okay. I have noticed feeling a little tired in the afternoons, but otherwise, no major issues. My joints have been a bit stiff too, especially in my wrist.
That fatigue could be one of the side effects we discussed. Let's check your blood pressure first. Nurse Johnson took it just now, and it looks like it's 128/76, which is a good improvement. Have you had any issues with urinating more frequently?
That's a relief. I was hoping it would come down. The tiredness is a bit bothersome though, and no issues with my bladder.
I understand. We can certainly adjust the dosage if it continues to affect your daily activities. Have you noticed any other numbness, dizziness, or anything unusual? Any pain in your jaw or cheek?
No, nothing like that. Just the tiredness and the stiffness in my joints. It's nothing like a cramp though.
Good. Let's talk about this fatigue. Sometimes taking the medication at a different time of day can help. We want to avoid any issues that could potentially lead to a heart attack or stroke, so managing your blood pressure is key. Are you taking it in the morning right now?
Yes, with my breakfast.
Why don't we try taking it in the evening before bed? That might help with the daytime tiredness. Keep monitoring how you feel, and if the fatigue persists or worsens, please call us. We want to make sure everything is okay, especially since you had a surgery a few years ago.
Okay, I can do that. How long should I try taking it at night?
Give it a full week. Keep a log of your blood pressure readings at home if you're able, and also note your energy levels throughout the day. We'll schedule another follow-up in about a month. It's important to keep an eye on things, especially with your history. We want to avoid any need for the ICU down the line.
Sounds good. Thank you, Dr. Lee.
You're welcome, Mrs. Davis. Take care. Scenario 2. Sick visit, acute illness. Good morning. What brings you and your child in today?
Hi, Dr. Evans. My son Leo hasn't been feeling well for the past 2 days. He has a fever, a cough, and he's been really tired. He also mentioned his gums feeling a bit sore.
Okay, I see. Leo, can you tell me a little more about your cough? Is it dry or are you bringing anything up? Does your armpit feel tender at all?
It's mostly dry, but sometimes I cough so hard my throat hurts. And no, my armpit feels fine.
And when did the fever start? Have you noticed any rash?
It started 2 nights ago. It's been around 101 to 102 Fahrenheit. We gave him some children's Tylenol, which helped bring it down a little. No rash so far. We were worried it might be chicken pox since it's going around school.
Has he had any severe sore throat, a runny nose, or any problems with his ears? Have you noticed him rubbing his cheek or jaw? We might need to consult with ENT if it's an ear issue.
He said his throat felt a little scratchy yesterday, but not so much today. He has been a bit more tired than usual. He hasn't been rubbing his face.
All right, I'm going to take a look in his ears, nose, and throat. Can you open wide for me, Leo? We also need to check if there's any swelling around his gallbladder area. His throat looks a little red, but not severely. Ears look clear. Nose isn't too congested right now. I'm going to listen to his breathing. Take some deep breaths for me. His lungs sound okay. Given the fever and cough, it could be the flu or another common virus. We can do a quick swab to check for flu if you'd like. We also need to rule out anything more serious, although it doesn't seem like kidney stones or anything like that.
Yes, please, that would be good to know.
Okay, we'll have those results in a few minutes. In the meantime, it's important he gets plenty of rest and fluids. Make sure he urinates regularly. It's also important for his immune system to recover.
Okay, what about school? When can he go back? We have a dentist appointment next week, too. I hope he's better by then.
He should stay home until he's been fever-free for 24 hours without any fever-reducing medication, and he should be feeling better overall. The flu test came back negative, so it's likely a common cold or another viral infection. His immune system should fight it off. This is different from issues related to the uterus or fallopian tubes, of course, and it's not something we'd typically see in the operating room.
Okay, that's good to hear. Is there anything else we should be watching for? I'm not currently breastfeeding, by the way, if that's relevant.
If his fever spikes again, if he has trouble breathing, or if he develops a rash, please call us or bring him back in. Here are your discharge instructions. Make sure he finishes the full course of any medication we discussed, even if he starts feeling better. We also want to ensure there are no signs of anything like breast cancer, although that's not typical at this age.
Thank you, Dr. Evans.
You're welcome. I hope he feels better soon.